Yeah, so full stack virtual care is really synonymous with integrated and coordinated care. So by that, we mean we don't just have one practitioner working with a member. They have the opportunity to see a team of practitioners, and that can be a health coach, a registered dietitian, a nurse, and moving forward, that will include gastroenterologists and internal medicine specialists as well. And the importance there is we know that everyone needs different types of care at different times. And so we want to make sure that we're optimizing getting people to the right care at the right time. So at Vivante, we're taking privacy and data security really seriously. I think that continues to help differentiate us. So by example, we are SOC 2 certified. So we've done external audits on how we handle patient data. And it's really part of our ethos is security is paramount. We would never sell or share our patients' data without their consent. And I think that this is something that is really important for any organization. And for us, we work with a lot of major health plans, a lot of major Fortune 100 companies who have also completed security audits on our solution. And we've passed everyone. And so we do continual penetration testing, continual security audits, and it's something that all of our team takes really, really seriously. So digestive health is, I think, really unique. And I mean that by it's an area where digital innovation can have an outsized impact. And that's because digestive health is broad. It includes a number of different conditions and a number of different symptoms. So you've got things like Crohn's disease, ulcerative colitis, irritable bowel syndrome, GERD. We also work with patients who don't have a formal diagnosis today, but have a number of symptoms. And when you look at these conditions and these symptoms, there's no novel biomarker that points to how is the patient doing. And so what's really important is at Vivante, we've invested heavily in getting very good at looking at disparate data sets and using AI and machine learning to leverage pattern recognition and to recognize, okay, this is what this specific patient will likely need, and how do we provide them the best care at the right time? And I think what's unique about digestive health is the unique needs of these members, and then also the struggle from the traditional care ecosystem to provide them that ongoing support on a daily basis. Because if you know someone, or if you yourself have ever suffered from these conditions or symptoms, they're really difficult, they're painful, and they're lonely. They aren't symptoms or conditions that are easy to talk about. So providing that ongoing level of support each day is really important. So I think that's why digestive health is a great opportunity where innovation and technology can help support those members on an ongoing basis. And that's what we've seen at Vivante and in terms of how we work with our members. Yeah, so I think for us, what's really important is that overall journey for the member. And so it starts with understanding the needs of each member. So we do an intake where we're understanding their clinical profile, but we're also understanding what personally are they looking for? What do they want to get out of the solution? Because as you can imagine, every member is completely unique, just like all of us are completely unique. So we really try and build that profile day one. And then from there, we're using technology to build these evidence-based clinical pathways, but then we're supporting it with a remote care team so that they can have access to a care team right at their fingertips. And so I think that combination and that all-in-one solution is really, really important. And when we think about us compared to the rest of the market, I think what we've been able to show is incredible outcomes at scale, both in terms of reducing symptoms, getting people feeling better, even impacting things like decreasing anxiety and depression associated with these conditions. And then we've also been able to show financial outcomes at scale. So reduced emergency room visits, reduced duplicative doctor visits, better medication adherence, and overall cost savings for the plan sponsor, north of $1,000 per member per year. So we know we're having a great impact for the members. We know that we're saving cost. And I think that's all part of a full integrated solution where we put the member at the center of everything that we do.